Hey there, it's another What the Fuck Wednesday. I'm still researching for a video about taxation, but something happened again this week that left me speechless. Most of y'all are probably familiar with the Affordable Care Act, sometimes referred to as Obamacare. According to the government's Health and Human Services website, the ACA has three primary goals, and I quote, make affordable health care or make affordable health insurance available to more people. The law provides consumers with subsidies, premium tax credits that lower costs for households with incomes between 100% and 400% of the federal poverty level. 2, expand the Medicaid program to cover all adults with income below 138% of the federal poverty level, and not all states have expanded their Medicaid programs. And 3, support innovative medical care delivery methods designed to lower the costs of health care generally. So before I get into my experience this week, what is the federal poverty level? It is a term typically meant as a reference to, and again I quote, the poverty guidelines updated periodically in the Federal Register by the U.S. Department of Health and Human Services under the authority of 42 U.S.C. 9902. So the census also has a poverty threshold they calculate to determine statistically how many people are living in poverty. The HHS guidelines are used for determining eligibility for programs like supplemental nutrition, also known as food stamps, and Medicaid, things like that, social services. So what happened this week? Without oversharing someone's personal details, I helped an individual I know try to apply for health care coverage through this ACA. The person I helped has a gross monthly income of about $2,500 and a household size of one person. That works out to $30,000 annually. The federal poverty guideline for a family of one is $15,650 annually. Each additional person increases that number by $5,500. To be considered below the poverty line, my friend would need a household size of 4, at which the poverty level would be $32,150 per year. So a quick Google search for the average cost of a one-bedroom apartment in our area returned several figures ranging from $1,500 to $1,700, which I can tell you is accurate from living here and regular leasing listings advertised. For a 3-bedroom, the figures range even more broadly, but they range from about $1,900 to $3,500 or more. And I can tell you that the only 3-bedroom for $1,900 around here is going to either be in a dangerous neighborhood, tiny and mold infested, a 1 in a million chance, or a scam. The advertisements that pop up for 3 bedrooms around here are in the ballpark of $3,000 a month. So how did we go from health insurance to housing? Well, the greatest expense families pay is typically rent or mortgage. My friend who makes $2,500 per month, which is almost 200% of the federal poverty level, would have $1,000 left over after spending 60% of their income on the low-end price for a 1-bedroom apartment. $1,000 left over. Now, think about common expenses. These are things like utilities, phone service, internet service, car payment, car insurance and gas, or bus fare if they don't have a car, clothing, personal hygiene and cleaning supplies, and groceries. Notice that none of those things are discretionary spending like streaming services or eating out or entertainment such as video games or going to a concert, etc. We are just talking about the basic expenses of living at the simplest level, assuming even that their apartment includes a washer and dryer and they don't need money for coin-operated machines. As we applied for insurance coverage for them, I felt confident the result would be either free healthcare or something extremely affordable. And I was in for a massive shock.
What?
The lowest monthly premium offered to them was $222 with a $6,000 deductible. And their prescriptions they currently take every month, every day, would not be covered under that plan. The health plan finder recommended 3 plans as, and I quote, smart choice. The first was $225 per month with a $9,000 deductible. The second was $324 per month with a $600 deductible. And the third was $319 per month with a $900 deductible. And none of them would cover their prescriptions, which, by the way, are generic and old, not some new, trendy, expensive drug. So hopefully the what the fuckery of this is evident. Thus the What the Fuck Wednesday video. $1,000 a month, and that's going to be the cost if they want insurance when they $2,500 a month, but what's left after rent? Like, how is this affordable? So out of 33 developed countries in the world, we, having the most wealth of any nation, we're the only one without universal health care out of 33. Other countries, people in other countries actually make fun of us. I have friends in other countries who are also completely appalled by the government's failure to ensure access to health care for everyone. Meanwhile, insurance and healthcare corporations are making huge profits. Why do you think so many people celebrated Mangione instead of condemning him? It doesn't take much sleuthing to find the numbers. An article by The Lever notes that America's largest health insurers have raked in more than $371 billion in profits since the passage of the Affordable Care Act, with more than 40% of that net income going to the United Health Group alone. All this while the average American family's premiums have risen to an average of $25,572 per year, with an average annual deductible for single coverage at $1,787. And yet people are afraid of Bernie's unwavering call for universal health care because, oh, that's communism or socialism, or because it's going to cost too much.
I don't want to hear any more of this stupidity.
If you do the math, the average American family is already paying well over $2,000 per month for health care. So yeah, universal health care is going to save you money, actually. So I could easily go on about this topic for another hour or more, but I don't want to dive that deep into depression and despair. So I will wrap it up with this. The what the fuckery that is happening with access to healthcare, claims denials, and the absurd cost of healthcare is literally killing people, 68,000 a year, and shortening lifespans. It's fucked up massively, and there is no good reason for it other than money in politics and corporate greed, leading to dysregulation of the healthcare industry. I can understand why Mangione would do what he did. I also know that violence distracts from the most important message of any movement, healthcare or otherwise. We need to make our message loud and clear. And for me, that message is that healthcare is a human right, not a luxury. If people can afford joyrides to space, we can afford to take care of the healthcare needs for everyone in this country, period. We can also take care of providers like doctors and nurses and therapists, with a universal system that does not allow corporations to make mad amounts of profit off of our health care or lack thereof, while beating up our providers so much so that many have left the healthcare fields, and we can all enjoy better health outcomes than what we are experiencing now. The data supports this. I will link it in the description. And go follow Bernie Sanders, please, because he talks about this all the time. And it is so important and so relevant to every single person in this country, especially the working and middle class who are hit the hardest by these astronomical healthcare costs. Corporate greed in healthcare is not right, it's not fair, and we must fight back before it's too late. Not one more unnecessary death, not one. Please like and subscribe, share and tell me your healthcare stories in the comments if you feel comfortable doing so. What horror stories or like what the fuck moments have you or someone you care for endured, all while these healthcare corporations rake in record revenue and profits? If you have a story, whether you shared or not, I am truly sorry. I too have stories, and it completely sucks. It shouldn't be that way. It really sucks. And we all deserve better, every single one of us, and we can do better. So let's fight together for compassion, human dignity, and universal access to health care. We all deserve it, and it is absolutely possible, and it will cost us less money. All right, thanks for watching this week's What the Fuck Wednesday. Stay kind and take care.